Hi, my name is Chris Sterling. I'm a community health nurse with Siksika Community Health. And in this video, we'd like to discuss some of the homemade masks that are starting to crop up around Siksika Nation. And although these masks are very beautiful and we love the creativity and the initiative of individuals who are creating these masks, the drive to try to help protect their fellow nation members, we do need to discuss some of the dangers that come along with having a mask and the lack of need for it out in public. But I'd like to discuss how masks are protective in the first place. So health services workers like nurses, doctors and whatnot wear masks in very short-term scenarios where they're in the room for the patient for a very short period of time and they get out. And when they're done, they're disposable. They have to be thrown out. So homemade masks designed to go out into public, you're going to be wearing them for long periods of time, and the idea is that you would probably keep them. And this poses a bunch of problems, or poses risk for a bunch of reasons. One, even these surgical masks, after wearing them for about 10-15 minutes, they start to get moist. And what happens when they get moist, they allow the virus to pass right through the mask if it were to make contact with the mask through a cough or sneeze from the infected person. These masks are designed to stop particles. Okay? They only allow micro or about 5 micron size worth of things through it. Homemade masks, unfortunately, if they're just made out of cloth or what, I'm not sure what they're fully made out of, may not have those same properties. So they may not even be protective in the short term, even when they're dry. The other thing is they're not disposable. You would probably want to keep those masks. And that poses a risk because if there's any virus on it, that virus can live on that surface for quite a period of time. If you take the mask off improperly, you might be getting it on your hands, and then you could get it into your eyes, nose, and mouth, and then the mask becomes your source of contagion as opposed to a protective thing. Where are you going to put them? How are you going to take them off? Are you going to put them in your purse, put them on the car seat beside you? Are you going to stuff them in your pocket? Well, if that mask has any virus on it, you've now transferred that virus to other areas that you're going to be touching regularly, which then could get on your hands and then get into your nose, eyes, and mouth. What we do suggest, though, if you are going out in the public, masks aren't a good thing to wear. Don't go with a mask. Best thing you can do to protect yourself from droplets, which is what this is going to protect you against, from droplets from a person who's sick, is to make sure you maintain your social distancing. So that's 3 to 6 feet or 1 to 2 meters, and make sure that you're washing your hands on a regular basis. That's really the only thing you need to do when you're out in public to protect yourself, the two major things. A mask is not necessarily going to help you, and it'll be a false sense of security. If you have any questions regarding masks or other ways that you can kind of protect yourself, please give our hotline a call, and we'll put the number here down below, and we can try and answer any other questions if you have about that kind of stuff. But for the most part, masks, you don't need them when you go out in public. Just make sure you maintain your distance and you're washing your hands. Thanks.